And welcome to our meetup for the month of September. You're all welcome to be part of today's session. My name is Linda Itsipul, and I am the convener for the Women in RMEL, which also is Women in Research, Monitoring, Evaluation, and Learning. Today promises to be an exciting session. We'll be looking at applications of monitoring and evaluation in the health sector. And we have a wonderful speaker who will be presenting shortly. But before that, I would like to take us through our agenda for today, and then we'll do an icebreaker, and then we'll dive into our discussion for today. In the meantime, you're welcome to introduce yourselves in the chat. You can share your name, where you're joining us from, and yeah, anything you want us to know about you, your career, and if you have any particular expectations of today's session. All right, so I'll share my screen now, and you can confirm if you're able to see my screen. Okay, great. So this is going to be our agenda for today. So I will take us through a short icebreaker, as I mentioned, and then we'll welcome our speaker. So I'll introduce our speaker for today. She'll take us through our presentation. Then we'll have a Q&A session, or if you have any feedback to share, that's also the moment to do that. And then I will take us through some announcements, and then we'll end our session for today. All right, so for our icebreaker, we are going to test our knowledge as research, monitoring, evaluation, and learning professionals with regards to what terminologies we might be familiar with or some that we might not be familiar with. So I will read out, I'll give you a clue, and then you have to guess what that particular terminology is. Okay, I hope that's clear. So I would like you to feel free to type in the chat, or you can also unmute yourself and provide an answer. So I'll give you a few seconds to think about what I've read. I'll read each clue twice, and then you'd give me an answer. Okay, so here's the first one. So it says, I am work performed through which inputs such as funds, technical assistance, and other types of resources are mobilized to produce specific outputs. What am I? I'll take it again. I am work performed through which inputs, such as funds, technical assistance, and other types of resources are mobilized to produce specific outputs. What am I?
Inputs.
You're almost there. Please try it again. Okay, I see someone said projects. It's close, but that's not the answer I'm after.
Activities.
Yes, activities. That's correct. Thank you. Oh, I wish if we were in person, I probably would have given you a prize. But yeah, that's a good answer. So that's the answer I'm looking for. Okay, so for the second clue, here it goes. I am defined as an analysis describing the situation prior to an intervention against which changes can be assessed or comparisons made. I am defined as an analysis describing the situation prior to an intervention against which changes can be assessed or comparisons made. Okay, I see someone quickly typed in the chat
Benchmarks.
base baseline. Okay, so Mary got it first. Yeah, so thank you for all the other answers. So baseline is what I'm actually looking for. Baseline or baseline study. Yeah, so that's correct. Okay. All right, so we'll go to the next one. I am known as the extent to which the intervention achieved or is expected to achieve its objectives and its results, including any differential results across groups. I am known as the extent to which the intervention achieved or is expected to achieve its objectives and its results, including any differential results across groups.
Impact.
Not quite.
Outcomes.
No, it's close, but any tries?
Is it a theory of change?
No, no, please. Keep them coming.
Objectives.
No, please. Okay, should I give the answer? So what I'm looking for is effectiveness. Effectiveness. Okay, let's move to the next one. So I am referred to as the process of providing information to stakeholders that make them feel confident about how the organization is being managed and how services are delivered to service providers or service users. I'm referred to as the process of providing information to stakeholders that make them feel confident about how the organization is being managed and how services are delivered to service users.
Accountability mechanism.
Yeah,
Feedback accountability mechanism.
yeah. Accountability. Yes, yes. Bravo. That's good. Okay, so take the last one. I am a causal link between observed or expected to be observed into brackets, changes and a specific intervention. What am I? I am a causal link between observed or expected to be observed, all this in brackets, changes and a specific intervention. What am I? Okay, someone says results chain. Okay, that's the answer from Mary. No, please, that's not what I'm looking for.
A logarithm. Logical.
No, please. Please.
That is a TOC, theory of change.
Yeah, that's what it stands for. But
Mm.
that's not the word I'm looking for. Okay, let me give the answer because of time. So the answer I'm looking for is attribution. Attribution. So attribution is a causal link between observed changes and a specific intervention. All right. So yes, give yourselves a hand. That was a good round. Hopefully we'll have more of these in the future just to test our knowledge. Well done to you all. All right. So we've reached the meaty part of our meeting. I will now have the honor of reading the profile of our speaker. So our speaker is in the person of Soukeyna Ouedraogo, and she's an independent evaluator and researcher specializing in gender inclusion, sexual and reproductive health and rights, also known as SRHR, in West and Central Africa. With over 20 years of experience, she has worked with UN agencies, international NGOs, and research institutions to design, monitor, and evaluate projects that strengthen health systems and promote youth participation. She's passionate about feminist and participatory approaches to evaluation and has contributed to several regional and global initiatives on adolescent empowerment, digital health, and climate adaptation. Participants, I'd like to help me invite our speaker for today in the person of Madame Soukeyna. Soukeyna, please, you're welcome to the stage. We are all ears.
Thank you, Linda. Thank you so much. Thank you. Hello, everyone. So thank you for joining today's session, and thank you for the community for having invited me for today's session. So as Linda said, my name is Soukeyna Ouedraogo, and yes, I'm an independent evaluation consultant. I'm originally from Burkina Faso, but I'm based in Senegal. And much of my work has focused on health, gender, and youth empowerment across Africa. And one of the things I value most is learning with peers, which is why I'm truly excited to be here with this community. And now, before we dive in, let me just say that French is my first language, so you will have to forgive me for my very French accent. Sorry for that. Yes, so but today is not just about me, it's about us. And Women in MEL is a community, and this is a great opportunity to learn, share, and also connect with each other. So I will encourage you to introduce yourself in the chat when I'm downloaded my presentation. So you can give your name, for example, where you're joining from, and a short reason for why you decided to join this webinar today. It could be what you expect from this session, but also why the topic feels relevant to you, or simply curiosity to connect with other professionals in your field. So feel free to do that when I'm just connecting to my presentation. So yes, thank you. So now, if you can see, please scan the QR code on the screen to access Menti. And then there is a simple question. You can add few words. And if Menti doesn't work for you, no worries. You can also just type your words directly on the chat, or you just can go to Menti and they will ask you for a code and you just enter the code. Thank you so much, Linda. And yes, so feel free to connect on it. And the question is, when you hear MEL in health, what comes to mind first? So feel free to answer to it. And what is interesting with Menti is that we can have all your words into a cloud at the end, so it's great. So I will let just some seconds. So you can either go into it with your phone with the QR code, or you just go to this website, menti.com, and then you access it with the code. So I will check if we have some answers
It's
here.
not accepting for some of us. I don't know what the problem could be.
Oh, really? It's a pity. I don't know why. It's completely public. You can also type it on the chat
We'll try
in this
again.
case. So some of you are thinking about wellness, great. About confidentiality, Very interesting. About systems, yes. About tracking, systems again, yes. What else? What do we have in the chat? Um, we have something else. Nothing in the chat. Okay, so yes, it's a lot about systems, but also confidentiality, yes, and tracking. We will go across all these words today. So thank you for those who played the game. And then we will switch directly and go right now into the subject. So now let's ask, why male and why health? And why do we put them together as a crucial issue? As you may know, health programs are very complex and they involve systems, as you said, systems like hospitals and clinics, but also behaviors. Someone talked about confidentiality, like how people seek care, but also environments like water, housing, or even climate. So MEL gives us tools to make sense of this complexity. It's not only about data, like we usually talk a lot about data when talking about monitoring and evaluation, but it's also about accountability. We've seen this word during the icebreaker. It's also about learning, but also about inclusion. So when we bring monitoring, evaluation, research, and learning and health together, we have to make sure that health programs are not only tracked. Someone talked about tracking. This is very important, but not only. We should seek and try to understand if these programs are also adapted to people's needs. We should make sure that voices are heard, especially those of women, young people, and marginalized groups. And it helps link evidence to real decision in health policy and practice. So that's why monitoring, evaluation, research, and learning, MEL, and health must go hand in hand. This is really important. Now we can just have a quick look at this acronym, MERL. So first, at the beginning, we were only talking about monitoring and evaluation. It was mostly about checking numbers. Then we switch into MER, adding research, which gave more depth. And now we are more talking about MEL, where learning is at the center. So it's a continuous cycle. First we track, then we assess, then we build evidence, and then we adapt thanks to learning. So each of the letters count. So here is my first question for you in the chat, because I like when it's quite interactive. I will talk a lot, so I will be also interested by what you think. My first question for you in the chat is, in your own work, where do you feel learnings get lost the most? Is it during data collection that we lost learning? Is it during reporting or when it comes to decision making? So in this cycle of tracking, assessing, building evidence, and adapting, where do you think that usually learning can get lost? So this is my first question, and you can exchange and propose some answer in the chat. Now, let's talk about what MEL looks like in health. MEL in health can be applied across three main domains, I will say. You have lots of way of classifying health, but my favorite one is that one. So first we have public health. This is about services and systems that reach the whole population. It includes clinics, hospitals, vaccination programs, and primary care. Here, MEL helps us check if services are, for example, accessible, if they are effective and reaching everyone. So it's not only, here again, it's not only about numbers, but also quality. Second, when talking about health, we can talk about global health. These are issues that do not stop at borders. Examples are HIV, migration, and disease outbreaks, for example. And in these domains, MEL helps us compare, for example, across countries. It can help us share evidence and respond to global challenges together. And third, we can talk about planetary health. And in this case, this is about human well-being, wellness, but not only. It's about human well-being within the limits of our planet. We then talk about climate change, air pollution, and food insecurity, because all of that have direct effects on health. In this case, MEL helps us measure and show how environmental changes affect people's lives and how health systems can adapt. So as you can see, MEL in health is really complex, and you have all these circles that comes together. But it's also very powerful because it allows us to connect the local level of services, for example, with the global level of cooperation, and then the planetary level of environment and climate. So let's take some few seconds, and I count on you to participate in this time. Just on the chat, one word. I would love to hear from you in the chat, which of these three, public health, global health, or planetary health, best matches your own work or interest area. Just write one word like public, global, or planetary. And if your work touches more than one, you can also type mixed. Okay, so I have public health, planetary health, public health. Yes, usually it's a lot about public health. Planetary health is more and more common. I would say it's more fashioned. But yes, in a more conventional way, we talk about a lot about public health in general, but the scope is getting broader and broader. So how do we assess? This is one of the question that most of you would like to know and understand when talking about health programs. How do we assess them? You have lots of ways to do so. But in evaluation, for example, we use the OECD DAC criteria, and we can adapt them to the health system. So let me go through them one by one. When, for example, evaluating a health program, we will question the relevance. We will ask, does the program respond to real health needs? For example, does it address adolescent well-being, sexual and reproductive health, HIV, or crisis situation? This is the relevance. We can also question the effectiveness. Are we really achieving better health outcomes? And are we really changing behaviors in practice? This is the effectiveness. When it comes to evaluating the efficiency, for example, we can use resources like funding, staff, and time in the best way for the biggest impact on health. So in this way, for the efficiency, it's a kind of ratio calculation when you will see if the resources are well used. Then there is the sustainability also of the program. Will the benefits continue after external support ends? For example, are activities integrated into the Ministry of Health systems? This is something very important to question. We can talk also about the impact. What are the broader long-term effects on health systems and communities? There is also the coherence. Is the intervention aligned with other policies in health, in climate or social protection, for example? And I have added two more dimensions that were for me very important in health. The first one is equity and inclusion, because it's important to ask ourselves, who is really benefiting from this program? Again, are women, adolescents, people with disabilities, and migrants included? Another topic, another dimension is the resilience. We should ask ourselves, can health systems and communities continue to function during shocks, such as pandemics like COVID, continue to function during climate stress or migration? All these questions are very important. So here, monitoring and evaluation is the ability to connect evidence, policy, and practice. Again, as you have seen in my question, it wasn't only about data. It was a lot about using that data to inform decisions and improve health for all. Now again, do you have yourself some, let's say, regular or relevant questions you think it would be great to ask ourselves when evaluating a program, for example? Something that I haven't mentioned and that you think should be very important to question when evaluating a program, or very relevant questions you came across during your professional experiences. Again, yes, can we link resilience to sustainability in a way? For sure, because as you've seen, even the beginning of the question was the same. The only difference is that sustainability is for common path, I mean in a regular basis, whereas resilience talks a lot about shocks, about specific events that can occur and just changing the system you are in during the programmation. So they are different in that sense, but this is, yes, the same idea. Thank you for that question. So we can move on to the next slide. So this was about assessing, evaluating. So here, On the previous slide, we focused more on the criteria we use to evaluate health programs, things like relevance, effectiveness, sustainability, or equity. But MERL is not only about evaluation at the end of the project. It can also be applied in monitoring. The difference is that in monitoring, for example, we will assess the quality of services on a regular basis while programs are still running. We won't wait until the end, like for evaluation, to ask some questions. So this allows us to make improvements in real time. To do this, we can use, for example, the WHO Quality of Care Framework. And this framework looks at 7 dimensions that help us understand what quality really means in health services. Let me walk you through them one by one. Let's say, for example, effectiveness. For effectiveness, services should follow evidence-based guidelines, not personal opinions or outdated practices. For example, in family planning, providers should offer the full range of contraceptive methods recommended by the WHO. And it's not the nurse who has to decide that because of, for example, her own values, she won't decide to give this kind of family planning. So this is how we can monitor the effectiveness of the service. Does it really propose the whole range of solutions? We can also monitor safety. In the beginning, someone talked about confidentiality. So care should protect patients and reduce risks. Unsafe care can cause harm, not only physically, but also mentally. And that harm can sometimes be worse than the illness itself. If a young girl, an adolescent girl, keep going to health services and find that all she's saying, she told the nurse, come back to her through her mother, we can make sure that she won't come back anymore. And this is something very important. Also, people-centeredness. So services should respect people's dignity, preferences, and culture. It means that every person should be treated as human being, not just as a case or a number. We can talk also about time, monitoring the time. Care should be delivered without harmful delays. We all know that waiting too long for a test, for treatment, or even in a clinic waiting room can make a big difference in health outcomes. And indeed, in some rural areas, that is the reason why lots of people don't go to healthcare centers, because they don't have time, they should work. So they know that if they go to this hospital, for example, it will take them the whole day. We can also monitor equity. Quality should be equal for everyone, whether you are rich or poor, living in a city or in a village, young or old. The quality of care should not depend on your background. We can also monitor integration. Services should be connected across different levels of care. For example, if an adolescent starts with a school health program, they should be easily referred to a clinic without falling through the cracks. And the last dimensions that this framework enables us to measure is the efficiency. Resources should be used in the best possible way in many health systems. Money, staff, and time are very limited. So efficiency is not just technical, it is an ethical responsibility. And what does it mean also? MEL can track not only outcomes like the number of people reached, because this is something we often come across, like we are asking for monitoring and evaluation, and we only have numbers like today, this number of women came, this number of children were we gave care to this number of children and so on. But in the health system, the experience of care is very important. This means that looking at what clients actually live through when they access health services is very important. For example, was a consultation for sexual and reproductive health confidential? Did the provider speak in a respectful and non-judgmental way? Were adolescents given enough time and the right information to make their own informed choices? All these are very important because even if services exist, if the experience is poor, people will not use them. Respect, dignity, and confidentiality are just as important as the service itself. Let me give you other concrete example. When we evaluate family planning on sexual and reproductive health services, we do not only look at numbers like the number of condoms that have been delivered. We also measure provider attitudes, how friendly and respectful they are. We check waiting times, whether young people had to spend hours in line. And we ask about confidentiality, whether the service felt private and safe. And all of these aspects can make the difference between a young woman deciding to use the service or deciding never to come again. So this is, again, very important. And this is related to my next slide, that is dealing with adolescents. Adolescents face many challenges when it comes to sexual and reproductive health and rights. They often deal with taboos, stigma, or misinformation. For example, talking about contraception, menstruation, or HIV can still be seen or perceived as very shameful in many communities, as you know, especially in Africa that we know. This makes things very difficult for young people to access the information and services they need. MEL gives us different approaches to better understand and improve adolescent well-being in this area. Some examples are, for example, things that I had used before is the CAP surveys. The CAP surveys, there are surveys that help us to measure knowledge. So the K is for knowledge, the A is for attitudes, and the P is for practices. For instance, we can see if adolescents know about their rights, if they feel confident to seek services, and what myths or fears they still have. And we do it as a baseline. As you see, I'm using words that already have been introduced at the beginning of the session. So we do this survey as a baseline at the beginning. We assess the knowledge, the attitude, and the practice. We will use the exact same survey, asking the same questions, and we will measure the difference to see if there is a positive evolution. Another tool that I find very interesting is the most significant change stories. These stories help us capture the lived experiences of young people in their own choice, with their own words and their own voices. Thanks to these stories, we can know more about their experiences. They tell us not only what happened, but also why it mattered to them. So this is something very interesting. And there are lots of other confidential feedback tools. This can be digital apps, for example, chatbots. We talk more and more about AI and health because they are very powerful tools when it comes to privacy issue. And other safe channels. It can be any other safe channels. So they allow young people to share feedback without fear and in private. There are also some key areas where MEL is especially important. The first one is access to family planning and menstrual health services. We need to know if adolescents can actually get the services and products they need when they need them. I'm thinking, for example, about menstrual pads. So it can be the fact that, okay, we had a health program, we have distributed lots of menstrual pads, and we are happy. And then 1 year after, we go back in the same area and we see that no one is no more using it. Why? Because they don't have the money to buy it. So then maybe we will decide, thanks to this evaluation, to not to distribute usable pads, but maybe reusable pads. And to go further, maybe we can decide in this sexual reproductive health program to give some training to help these young girls produce their own reusable pads, for example. So this is there are very important questions because when it will come to decide the kind of inputs we want to put into the project, it can be so many different inputs, but only the evaluation will help us to decide. And addressing HIV, for example, addressing HIV is something also very important because here we will talk about stigma and barriers. And we know that stigma can prevent young people from going for testing or treatment, even when services are available. So maybe after the evaluation, we can decide that young people need a private access to some services at some hours or in some conditions to make them feel safe. And also the question of mental health. Adolescents often struggle with anxiety, shame, or isolation. And monitoring, evaluation, and research can help us see how programs respond to these mental health needs. Now I would like to talk about behavioral and social change which is very important when talking about health programs. Up to now, we have seen how MEL can be applied in evaluation of programs with the OECD criteria. And also, we have seen the monitoring part with the WHO framework to assess, to monitor the quality of services. And now, let's move to the third area where MEL is essential: research. So health outcomes do not only depend on services or systems. They also depend on behaviors, on norms, and attitudes. And this is where MEL help us see if sensitization and awareness campaigns really lead to real change. Because there are, it's again easy to implement a program and say, okay, we have done our best, let's see what happened. But if you haven't taken into account the behaviors, the norms, and attitudes, you can be sure that it will completely fail. And that is why we use some other models, frameworks, that will help us monitor, evaluate, and take into account behaviors, norms, and attitudes into a program. There is, for example, the COMBI model, which tells us that behavior depends on three things. So, for example, when you want to assess the behavior, you will assess the capability, the opportunity, and the motivation. And these three together will help you know if the potentiality of change of your program. There is also the health belief model that is very important also because in this framework, it looks at how people perceive risk, benefits, and barriers, and what finally pushes them to take action. Why some people will go to vaccinate their children and why other people won't, for example. So very important. Here is a simple example where social and behavioral change are important. Imagine a family planning campaign. We can ask, did it increase awareness? But we should also ask, did it reduce myths and stigma? And did it lead to higher uptake of services? And here I would like also to share an example from my own research. So I'm a monitoring, evaluation, and research consultant. So I'm also doing research because I think that thanks to research, it enables us to understand better the context where we are implementing our programs. So I have, for example, worked with DHS, demographic and health surveys data to explore sexual and reproductive health, especially around contraceptive decision-making. And what we found is that knowledge, but also beliefs about contraception, but beliefs also about intimacy, all these beliefs can shape the decision. Social norms, partner influence, and power dynamics in relationships play a huge role in whether women and girls can actually make and follow through on contraceptive decision. And this is really important. And that's where the research comes from. And this is where the research can be perceived as really essential. This shows us why it is so important to include not only data on services delivered, but also research into behaviors, norm, and decision-making. As another important subject related to health, I wanted to talk about the fragile and crisis context. Unfortunately, it's more and more common to have to implement, evaluate, monitor projects within this crisis time, let's say. So when populations, for example, are on the move because of epidemics, because of floods, because of conflicts or displacement, we know that access to health services is often disrupted. People may lose contact with the health system, and their basic rights to health care can be at risk. And in these situations, MEL plays three important functions. The first is to monitor continuity of care. For example, we need to track if HIV treatment, maternal health services, or vaccinations continue even during the crisis. If this continuity is broken, the health consequences can be very severe. Also, thanks to monitoring and evaluation, we can assess equity of access. We can check if refugees, migrants, and internally displaced people that we call IDPs must be included in health services. It helps monitoring and evaluation in this case will help us check if they are receiving the same opportunities for care as host communities. And third, MEL can help us capture a community coping strategy and resilience. For example, in crisis, communities often develop their own ways of surviving and supporting each other. We know that. In this case, MEL will help us document these strategies, these coping strategies, so they can inform better responses in the future. So for the person who was asking what is the difference between sustainability and resilience, here you can see, here it becomes obvious. Resilience, we will talk about resilience when we talked about the capacity to find coping strategy to go behind these crises, whereas sustainability was simply trying to understand if what we have implemented will continue in the time. So this is the difference. And to do this, we rely on specific frameworks. For example, there is the sphere standards for humanitarian health, which define minimum quality of care in emergencies. And we also have the principle of accountability to affected population, which is a framework that ensures that people in crisis are not only recipients of aid, but also have a voice in how services are designed or delivered. So very important. And then one of my favorite topic is this one, linking climate and health through monitoring and evaluation. We know that climate change has a direct impact on health outcomes. For example, it increases health stress, it increases floods, air pollution, and vector-borne diseases like malaria or dengue. It worsens food insecurity and malnutrition, and it adds mental health stress, especially for young people and vulnerable communities. So how do we respond? This is where MEL becomes powerful because it brings together monitoring, evaluation, research, and learning. So in this case, monitoring will help us collect regular data on climate and health indicators. For example, tracking the number of heat-related hospital admissions or the spread of malaria after flooding. This is monitoring related to climate change and health. As for evaluation, it will allow us to assess whether climate adaptation programs in health are effective. In this case, we will ask, are early warning systems working, for example, or are community interventions reducing risks, for example? This is the evaluation part. When talking about research, now research will help us go deeper to understand the links between climate events and health behaviors. For example, in my own context, research can look at how floods in urban areas here in Dakar affect adolescent mental health and decision-making around sexual and reproductive health. And this is, for example, a research that helps us to gain more knowledge of the context of the behaviors of the beliefs of these people. And then the learning closes the loop. It means using the evidence from monitoring, the evidence from evaluation, and the evidence from research to do what? To adapt policies, to improve programs, to share lessons with other sectors like education, environment, or urban planning. As you see, learning is the key points to close the loop. why are we doing monitoring? Why are we doing evaluation and research if at the end it doesn't go back to the people who has the capacity to take decision? And there are lots more and more frameworks that can help us to close this loop with learning. We have communication tools, we have capitalization tools, lots of tools. I am almost at the end. And I just wanted to ask you a little question on what still holds us back. I mean, we know the situation, and yes, we do lots of improvement in health, but I wanted to have your feedbacks on what, in your opinion, can hold us for not applying what we learn through monitoring, through evaluation, through research. So what creates this gap between MER and, in the other side, the L of learning? And if Linda allow me, you can open your microphone, you can give some answers into the chat, but it will be great to have one or two opinions on that. Yes, Esther.
Thank you very much, facilitator. These are very great conversations. I was just thinking through that each of these functions, the research, monitoring, evaluation, and learning, are very integral, but they are quite a lot of tasks. And I think for me, my main challenge on a daily basis has been that it's quite a lot of work. And sometimes we tend to focus on the demands. When we look at the human resource, usually the male or the male teams, they're usually very thin. And also the investment that organizations or projects have towards all these components or functions of our meal. Sometimes the investment or the amount of funding or monies cannot allow for all this to happen at the same time, but also the resources. I think for me, that has been the biggest challenge. At some point, I'm just limited to maybe to mail only monitoring, evaluation, and learning. And then where there's quite a lot of research to do, which can inform the learnings, I find myself that I am unable to do that because of either the resource this in terms of staffing or the funding. Thank you. Or monies.
Thank you. Thanks a lot. And you're completely right. When it's not easy, like to have in the same place or in the same person, in the same service, monitoring, evaluation, research, and learning. And this is when having some platforms, even digital platforms, when all these specialists can just meet together and share together can be very interesting. And that's why also I wanted to know more about everyone's backgrounds. And I have encouraged you to introduce yourself in the chat because maybe some are here today for the monitoring part, others are here for the evaluation, some other are here for the research. And maybe there are some other people coming from government bodies, for example, that want to learn to know how to implement all these evidence into their policy. So yes, it's a challenge. And I hope that today, with all these digital tools and that we have with us, we'll be able to come across that. So here I have shared my opinion concerning that. Yes, what I think is that we have first what we call data silos. It's a little bit related with what Esther said, because there is a weak interoperability, I would say, because systems do not always talk to each other, which means information stays fragmented. And each one is keeping its own data on its own. They're happy, they have done the job, and they're happy with that. Yes, but it's a pity because what you have, what you get, has cost a lot of money and can be very useful for other people. Also, um, the data is rich, but the information can be poor. What I mean here is that we often have a lot of data, a lot, but we don't use it well to generate insights or guide decisions. And I was talking about the DHS, for example. This is a public source of data, but we have it, and then we don't know what we can do with it. And it's where research can help us maybe try to cross some of these topics to understand more how they are related, and to have cross-sectional topics, programming, and so on. There is also the question of taboos and stigma in areas like sexual and reproductive health, like HIV, and even more about mental health. Silence and stigma still mean that many voices are missing. I'm happy to see that we talk more and more about mental health, because health is not only about physics, and mental health can have lots of invisible consequences. There is also the evidence policy gap, because even when we have strong evidence, it is not always translated into real decisions, into real budgeting, or into new programmation. Sometimes we see fundings going into always the same activities again and again, always the same activities. When we have lots of evaluation reports that are telling us that maybe these activities need this and this context, or these activities should be stopped because it's harming this and these people. But yes, we don't know why, when it comes to programming, politicians don't just go back to these reports. Maybe also because the way we are reporting things are too theoretical. Maybe we don't do it correctly. Maybe the reports are too long. Maybe it doesn't give any envy to be looked at. So it's also our job to make our insights attractive. Maybe there is also limited capacity of ministries of health, for example. National systems often struggle to embed MEL, as I've said, maybe because of lack of staff, as you said, Esther, maybe because of lack of skills or resources. So all these barriers remind us that MEL, monitoring, evaluation, research, and learning, is not only about methodology also. It is also about power, politics, priorities, communication. And our challenge is to bridge these gaps so that MEL becomes a driver of real change in health. So to finish, where do we go from here? As we come to the end of this session, first of all, we have looked at monitoring, evaluation, research, and learning. We have seen how MEL can be applied in services, in behaviors, in crises, and even the links between climate change and health. But the real question is, where do we go from here? And in my case, I see 5 big directions. The one that is interesting is the one about digital innovation and ethical artificial intelligence. We now have opportunities for real-time health monitoring and evaluation using digital tools, AI, and dashboards. But we must also be careful with ethics, confidentiality, and inclusion. Another direction is the advocacy loops. MEL data should not stay in reports. It should fuel campaigns, inform debates, and push for policy change. Otherwise, they are just documentation. Another point is participatory monitoring and evaluation, research and learning. This means involving youth evaluators. This means involving community health committees, indigenous knowledge, and local voices so that MEL reflects the experience of the people itself, and not only people doing reports like me. And another point is cross-sector integration. Health is connected not only with health, it's connected with education, with climate, with urban planning, and more. So the next time you will think about doing monitoring and evaluation in health, please think about that. Think about the fact that you're not only there to evaluate services, you're not only there to count how many people came to that services. It's a lot about lots of things, about how the person feels, the family environment of the person. It's about the education of the person. It's about a lot of things. Health is not about only health. And at the end, the planetary health perspective is getting more and more important. We need resilience here because we are facing lots of health crises. And MEL can help us face global crises like pandemics, like climate shocks, like migration, by showing us that what works and how to adapt to these planetary and global crises. So MEL in health is not just about tools and indicator, and most importantly, MEL in health is not only about health. So yes, I think I will end here. I had some other slide, but it was just about diving more into some other specific things. So I want to sincerely thank you all for being part of this session, and I will give the floor to Linda. Thank you.
Thank you too, Soukeyna. Thank you so much for your insightful and brilliant presentation. I believe the audience can also attest to the fact that you've done a great job taking us through the applications of MERL or RMEL in the area of health and have also sparked some interest in some of us who are not directly working in health, but trying to see how our current jobs connect some way, somehow to health. So thank you very much. Okay, so I would like to invite participants to ask questions, or if you have any experiences you want to share, maybe if you're having any challenges or something you would like us to discuss as a group. And of course, seeking Soukeyna's expertise and advice as well. Yeah, you're welcome to do so at this time. So the floor is open. I know we've gone a little beyond time, but that's for a very good reason. That's time well spent. But if you can bear with us, just yeah, we just do this session and then we'll conclude shortly. Thank you so much. So any questions? Okay, I think there was a comment. a response to your question, Soukeyna, about why it's difficult for us to, uh, yeah, do more of MEL in the health sector. And it was Tammy who said, I think culture is the issue. MEL is very new and not yet established in many organizations. It may be seen as auditing duplicates too. Yeah.
Yeah, that is so true. I completely agree. And yes, we have to change it. And it's part of social and behavioral change also, and communicating. And the way we are communicating also about, I have came across consultants that are happy with that. They are happy to be feared. They are happy that when coming to say, okay, I'm doing an evaluation, everyone is completely fear them. So in the way we are also doing our job, it's part of the game. The first thing I say when I go to do an evaluation is that I'm doing this for the people I am evaluating. And the product that will come at the end will only serve this person to improve themselves. If they want, there is no obligation. So in the way that we are also communicating is very important. I completely agree.
True.
Thank you very much, Soukeyna. I really I wish to appreciate you very much. Thank you so much for allowing to share with us your expertise and specifically helping us to draw back our attention to the critical aspects. I just want to mention that I think one of the challenges that I've seen is also the planning processes. In my previous work, I realized that once a project or program takes adequate time to plan comprehensively for MEL, then you're able to achieve the best results. But also the other aspect is how long is a project how long is a project? Very short projects have very many demands, and sometimes it becomes very difficult to address all of them in a very short time. So my experience is we recently had a project with I was on a project with the SNV. It was for 5 years, and I really saw how because of very good planning, but also because of the need, the demand was naturally there for different aspects, research and learning, because the project had ample time. So we find ourselves reflecting all the time. And as a result, we ended up ensuring that we touched on different aspects. The research topics would come naturally out of the questions and reflections that would come from um, the people that we are working with. So those two aspects are also very important. And so we need to plan very, very well. If we think if we think that the things will happen, just sometimes it's not the case. It needs to be planned and prepared ahead of time, such that we can be able to ensure that work happens at all stages. Thank you.
Thank you so much for this contribution. And I remember a nurse telling me, okay, you come today, you ask me some numbers, you ask me some tables, but I'm not paid for that. And I didn't know that you were interested in it. So, and she's right. She's doing a great job, but monitoring and evaluation is also part of the planning. So if maybe we had think we had thought about saving sometimes in her day to tell her, okay, you can work from 8 to 4, and from 4 to 5, you have to save time to report these elements. And yes, so you are completely right. Maybe it has also to be planned with health workers to see what is feasible, what is not, and how to do it better. Mhm. Someone else to reflect on that or on anything else?
Okay. Seems everyone is fine at this point. And yeah, I'm sure after here, they can reach out to you on LinkedIn and send you an email. So thank you very much for sharing your contact details as well, Soukeyna. Any final words before we draw down the curtain today?
I just wanted to thank the whole community, you, Linda, but also the whole community. You're doing a really great job, and thank you for this opportunity to meet monthly around all these thematics. And I really hope that yes, it will help more and more people like me. I remember the first day, the first time I have joined one of these sessions, I was so happy to see that more and more women are trying to share together with each other their professional challenges, but also knowledge and vision. So this is a really great platform, and I wish you the best with this. Thank you.
Thank you too. And yeah, we look forward to having you again sometime in the future to yeah, talk about a similar topic or something that is also dear to your heart. All right,
Great.
so before we leave, I would like us to please provide feedback on today's session. So I've dropped in the link to our feedback form. Please feel free to suggest any topics or a resource person, or if you also want to volunteer yourself, please feel free to indicate in the form. And then I've also shared our social media handles. So on X, you can find Women in RML there. So that's the link I've shared there. And then the second link is our LinkedIn page. So please feel free to follow us on LinkedIn to get updates on our subsequent meetups. And then lastly, I've also put the link to our YouTube channel where you can access recordings from previous sessions. And today's session will be uploaded there shortly or in a few days. So yes, once you follow the page and you subscribe, you can easily get an alert on when the new upload is available. On this note, I'd like to thank you all for making it today, and I look forward to next month's meetup. Hopefully, I'll see you all there. Enjoy the rest of your week, and yeah, a happy end to the month of September as well. Bye for now.
Thank you very much.
Bye.
Thank you
Have a
so
nice
much.
afternoon. Bye
Sure,
bye.
you too. Bye.
Bye. It's
Thank
a
you.
night, a good night from Uganda.
All right, sure. Take
Yeah.
care. Good night.
Bye bye.